Welcome to sNAPAshots, conversations with professional, practicing, and applied anthropologists.
My background is in HIV and AIDS. And so with the work that I do for the federal government, working in HIV and AIDS, really I take a practical approach, making sure that individuals have culturally responsive prevention, intervention, and treatment of HIV care. But with that, really making sure that I take the tools that I have learned as a medical anthropologist and that individuals are able to shape and tell their own stories as we actually employ that HIV care. So that's the short story. I also do community consultant, really teaching within the community. I'm also a preacher. So that's why I say I do a little bit of it all, but taking all of that in an interdisciplinary approach to take it as a holistic approach in terms of human services. In terms of everything that I do, I take everything that I have learned. Like I say, I have an interdisciplinary background. I have a background in public health. I have a master's in public health. I have a master's of divinity. And so with anthropology, it was that missing piece of the puzzle that now helps me bring a holistic approach to everything that I do. You can't do anything without the voices of the community. It's not just a matter of going in and telling the community what you're going to do, but you have to engage the community before you take the programs to the community. And then once you do the programs, you have to go back and take the programs. You have to go back and take the work to the community and show the community what you have done. So really making sure that everything you do is, or everything that I do is holistic and it's full circle, and really have taken all of that and understanding that those anthropological methods, the anthropological theory is important from the beginning to the end, as well as inclusive in the middle as well. Meryl Singer came up with syndemic theory. And so understanding that with syndemic theory, we have these co-occurring conditions. And so it's not just about looking at one aspect of HIV, but understanding that there are so many different layers or so many different aspects of how HIV works together. So it's HIV, and then we have these co-occurring conditions. It's a matter of looking at the social, the cultural, the environmental, all of that. It's not a either or, but it's all of that. Sometimes we have to take anthropological theories that are out there and reshape them so that they will be more useful in the populations that we are working with. We talk about this epidemic and we talk about ending the epidemic, but we have to understand that we cannot or we will not end the epidemic until we have included all the voices that the epidemic impacts. And so when we look at anthropology, anthropology includes engaging all the voices of the problem. We can't end the epidemic if we're not engaging the actual community of who the epidemic impacts. If it's not just a select few. So what I see is when I go to some conferences, there are other people who go into the field and they collect the data and then they write the stories. But we have to allow individuals to tell their own stories, and that's something that I am a very much proponent of. Allowing people with lived experience to tell their own stories. And as I say that, it's just really helping individuals understand that it's important to shape and write their own narratives. Sometimes we don't get respect. One of the things that I often say, everyone needs a good anthropologist on their team. I often say that at work. Everyone needs a good anthropologist on their team because we see the world differently. That is not something that was told to me. That is something that I would tell others. I may do it a little different, because of, the conditions that we're in, but I'm going to continue to keep doing it because, again, like I say, it's ministry. This is my calling. I got called to ministry to preach the gospel, and I was also called to be a practicing anthropologist, to ensure that, people are able to, like I say, tell their stories, shape and be able to tell the stories in their own voices. My dissertation focused on Black women, college-educated Black women, and middle-class Black women, their perceptions of HIV risk. And the thing about it was, I was told that was a population that did not exist. But what I realized, not only was it a population that existed, this was a much needed study that needed to be done. And having conversations with the women, realized that so many times they said no one ever asked our opinion. No one has ever asked what we thought. No one ever speaks to us because they don't think that we exist. And so that changed my view of anthropology. So many times there are populations that are left out. This needed to be an anthropological project in order to hear the voices of individuals that have been silenced, instead of just looking for data or trying to collect data of people that we think we need to find the numbers for. Anthropology allows us to hear the voices of individuals who need to be heard. I think when I was in school, I actually wanted to go into academia and teach. I actually was not trying to be a practicing anthropologist. My views from when I was in school to now have actually changed. I think myself as a student over 10 years ago, I would tell myself to look at different options. Don't limit yourself to what it is that you would do as an applied anthropologist or a medical anthropologist, but explore all the options that you can as a practicing anthropologist. Know that yes, you can teach, but there are so many other places that you can go and so many other places where you can make a great impact. Because once again, everyone needs a good anthropologist on their team.
Like what you see? Let us know. Find us at practicinganthropology.org, LinkedIn, Meta, X, Bluesky, and YouTube. SNAPAshots.